later on.
Ma'am, can I ask something?
Yeah.
Ma'am, is it mandatory to always mention the second name of the patient, or we can write the first name also?
Normally, whenever it is formal writing, we always address the other person with their second name. First name is generally used when somebody is younger than 18 years. Like if a young person, then we don't call them Mr. or Miss or Mrs., but we would rather call them by their first name.
Okay.
If the age is less than 18 years, then first name, otherwise the title and second name.
Ma'am, whatever the task is given in the nursing assistant or the medical management, but it is like what I observed in the task two, in the assignment two, ma'am, particularly. So the plan is given there, the discharge plan. But apart from that, had given some of the assessment also. So that assessment we need to club in this writing, or it is just what they did at the time when the patient was there in the hospital.
So there are two or three different ways in which assessment will be used as a subtitle. One is when the assessment is being written about a particular date. So in that case, it will be written under a specific date. Second, if it is assessment at the time of admission, then it will be written initially in the beginning of the information given, like after the social history and everything ends from the presenting problems, where assessment might mean physical examination findings. This is another meaning of word assessment. And when it is used just before discharge plan, that is the third way in which it will be used. If it is used just before discharge plan, it means it is for the patient's present condition and the things which are required right now, and some of them might be even after discharge, because that assessment which is written just before discharge plan, it means today's condition at the time of discharge.
So that has to be these things. We have to club this thing in our writing task.
Yeah, because the main reason why we are writing discharge letter is to tell what is the present condition of the patient and what are the care requirements.
Mm-hmm.
Ma'am,
Yes.
here like one letter I have completely misunderstood, and like first assignment, this that how do we come to know that the patient is going back to the same place of nursing home?
Okay.
I thought it was a first new case, and then I have written all the details, but
Is
it is
it assignment 2?
this is assignment 2, ma'am. Yes,
Okay, I'll share it on my screen.
Gerald Bakers.
Now, if you see here in this particular case note, if you read the social background carefully, it says leaves at Greywold's nursing home 4 years. What does it mean?
So he's there already.
Yes. And then we are writing to this senior nurse who is at Greywold's nursing home.
From the case note, we will be able to find out, because by looking at the case writing task, how to find out the patient is going back to the
See
if you can give.
here it just says write a letter. It doesn't say write a letter of referral.
Okay.
If it is a new patient, it would say write a letter of referral or write a referral letter.
Okay.
And then you can double check by looking at the social history, particularly if you are sending to a nursing home and things like that. You can see in the social history where was the patient before discharge.
Okay.
Because another reason you can understand this is if if it was for the first time we were writing, then maybe in the discharge plan it would say transfer the patient to nursing home.
Okay. So that hints will be getting in a discharge plan, either writing task or in a
Yes.
social bag.
Hmm. And mainly that
So
word in the writing task, a letter of referral or a referral letter.
okay, ma'am. So in this case, no need to include of past medical history because they knows
Hmm.
the condition, isn't it,
Yes.
ma'am?
Because here it says that the patient is with them for 4 years already.
Okay.
So definitely they
So
are aware of
no need
like
to write any of the medications and past history. Is
yes,
it not necessary?
because here it is given that osteoarthritis was the reason why he needed hip replacement. Now hip replacement has been done for the other leg as well. And 1989 he was diagnosed with hypertension and ongoing management, which means he's already on medication for it.
Okay.
And this here in aspirin it says recommend post-operatively. What does that mean?
I think patient was there in that medication
And
and
it
they
was
have again.
started. So that means both Remifil and aspirin are the old medications. So we can skip that. But this one is a new because of
New.
course after the operation it is for the pain management.
So, ma'am, like if one kind of the medicine is new, so do we need to mention the name of the drug, or it will be a simple sentence like monitoring of the medicine is also required? Can we mention in that way, or the name has to be there, ma'am?
But if there is any new medication, how will they know if you just write monitoring of medication is required? How will they know which medication have we started?
Okay. And
Any other
then can you
question?
please, could you please, ma'am, show again that your screen, ma'am?
Yeah.
Monitoring of post-operative disorientation design. Okay, ma'am, like the thing which is mentioned in the assessment, like post-operatively disorientation regarding time and place during
Hmm.
recovery.
Hmm.
So this is what I understood is like just after the surgery, the patient was for a while only he was disoriented.
Yes.
So
Yes.
still it's required like the patient can again go in the disorientation phase, ma'am.
Here it is written continued observation recommended. So this tells that the nurse at the nursing home needs to monitor continuously for the signs of or for the orientation status.
So that line has to come in just like if we are mentioning the patient was under monitoring for just after the surgery,
Yeah,
and
this
that has to
this
be.
disorientation is a complication that occurred due to anesthesia. So that has to be written as a complication. While writing a discharge plan, we don't write information that is, as usual. Like if, for example, if we are talking about um, checking the vital signs and, changing the dressing, those are part of protocol. But if somebody is developing problems, complications, then that should be written, isn't it? So here it was a complication, and also this complication needs further monitoring, which means we should write it as a complication and then we should be recommending that the nurse should monitor the orientation status.
Can we the same thing can be write in the past tense like he was kept on monitoring after surgery and
If
which has
I
to be continue after discharge.
if I say he was kept on monitoring, does it convey that he had disorientation?
But if we mention like he was kept under monitoring for these reasons.
Still, for example, if I'm monitoring someone's vital signs, does it mean their vital signs were abnormal?
No.
You are talking about two different things. He was kept on monitoring fine. Like now that monitoring can be normal as well. So how do they know that they develop disorientation after operation?
So rather than monitoring, the developed part should be more focused. This the patient has developed the disorientation and these things related to anesthesia complication or due to the anesthesia.
Yes, because OET is scientific writing. You cannot just, write vaguely or absurdly. It has to be specific. And then you can say for which continuous monitoring is required.
Got it.
Always, if you
And
focus
even
on
when
the
like
meaning and what you want to convey to the other person, then it will become easier to decide exactly which sentence should be used.
got it, ma'am.
Hmm.
And then like in this that they had especially mentioned the hemoglobin has dropped at what level. So that unit that has to be we have to mention it at or like a particular this the hemoglobin was at post-operative was at so and so and we had given for that so and so or
Again, because it is scientific writing, so we have to be specific. In this particular case, I'd say, even if you don't write the initial hemoglobin, current hemoglobin is very important because you are requesting them to for further monitoring and further tests.
okay, ma'am.
So this is the like from those for those of you who have come from IELTS or PT. In IELTS or PT, we talk about flaunting vocabulary and generalizing things, but in OET, you have to be specific. You cannot just generalize things by saying her vitals were abnormal or his monitoring was abnormal. You have to be specific exactly what was abnormal, whether it was high or low, whether if you are saying heart rate was abnormal, whether it was, rapid or slow, exactly how much was the heart rate. So some information, particularly if it is still a problem, you must write exact information about it. But let's say, for example, if you are writing about vital signs of a patient who was admitted with some problem, now you're writing the letter at the time of discharge, and at the time of discharge, the patient's vital signs are normal. So in that case, maybe the initial abnormal vital signs might not be required. You can directly write the diagnosis.
Okay.
Yes, because vital signs are required when somebody wants to make diagnosis. If they want to decide whether it is pneumonia or whether it is COPD or whether it is asthma, that's when they need details. Now, if you are writing at the time of discharge when the patient's condition is stable, then the initial abnormalities might not be relevant.
Okay.
Ma'am, here is equipment required also. The wheelie walker, wedge pillow. The social worker will be arranging or she has arranged already. That also got a confusion.
See here, ED is used.
Organized.
What does that mean?
She has done already. Few simple, like small reading in that within a time limit, it's very difficult, ma'am. Like understanding of the case note and then simple words also.
Yes. So that is why, the initial 5-minute reading time is so crucial. Most of the students find writing difficult or they don't get good score in writing mainly because they don't focus on the reading part. They start writing as soon as they get the question paper. And that's a wrong technique. First, you should understand the whole situation, then plan, and then start writing.
Ma'am, introduction paragraph in sample letter, you people have mentioned a date that admission date, whatever it may, whether we can mention or not?
Ideally, it would be helpful for the reader to know for how long the patient was in your care if you write admission date. But it is not necessarily in the introduction paragraph. It is also fine to write it in the second paragraph if your second paragraph is going to talk more about what happened after the admission. Then.
And ma'am, in this case, the equipment which will be arranged by the hospital as well as the social worker, they are going to organize a 2 week hire of riser from local. So the two parts separate. One the thing which is built by the social worker and another thing which is organized by the hospital itself. Only two sentences in one sentence, like the hospital has arranged the required equipments for the patient in one sentence.
You can, yeah. But then instead of just writing the required equipment, be specific. Exactly which equipments.
Okay. And is it also required to mention that they have arranged it from the local medical supplier?
I think that is fine if you don't include.
Okay.
But mainly it is important for them to know that the patient needs these equipments and we have already made arrangement for it. So now they don't need to intervene.
Ma'am,
If you
in
were the
case
one
note,
to receive this patient, then you would think, okay, if the patient needs this equipment, you will start checking whether your nursing home has all those medical equipments or not. If it is not mentioned that the hospital has already provided. So always, if you keep yourself in the reader's shoes, what all kind of arrangements and care plan they will have to prepare for this particular patient, it will become easier for you to decide or to select appropriate vocabulary for that particular situation.
in the case note, they have given HB. We can write in the letter HB as it is our hemoglobin. We have to expand.
So we have one particular lecture on this in week 4, genre and style, where I have discussed this in more detail. But to explain you briefly, when using short forms, you have to think about the audience awareness. Like if it is the short form which is very common, universal, and if you expect the nurse to be aware of short form, then full form is not required. But if it is not a very common one, like AF, AFib, not very common for the nurse. So in that case, it would be a good idea to write a full form. So you have to think from the reader's perspective, whether they will understand the short form that you have used. Is it something very commonly used in the medical field so that they can understand quickly? If it is an uncommon one, not a universal one, then write a full form. Now in this case, HB, is it a universal one or not?
Universal.
Do you expect the nurse to know this? Yes, right? It is very commonly used.
And can you just scroll up? Yes. In this follow-up, ma'am. So occupational therapy, daily dressing, surgery, incision site, the motion and stretching exercises with occupational therapists. They have done it when the patient was there in the hospital. With nursing management and progressment. Okay, so the daily dressing was happening for the
here in the discharge plan also it is given continue exercise program. So that gives us a hint that it needs to be continued after discharge as well.
Yeah. This the patient was admitted in different hospital in this case, ma'am. and they had given the follow-up at city hospital.
Yeah. Here also follow up. See here, the patient was admitted to city hospital only. The follow up will always happen at the same hospital where the surgery has been done.
Mm-hmm.
Most probably with the same surgeon who has done the operation.
City hospital only.
Any other questions? Aishwarya, Amin hasn't started writing as yet, so I'm not sure. Amin, if you have any questions. Aishwarya, if you do have any questions, feel free to unmute yourself and ask questions. Kiran, if you have any questions, feel free to unmute and ask. And it is not specifically to that particular assignment. The students were having questions from that assignment, so I was sharing that. We can also discuss if you have any other general questions or queries about the writing exam, or from the feedback that you have received if you are not able to understand where you went wrong, or probably what you can do to improve on it.
And generally, this past perfect continuous that has to be used when it was happening in the hospital and still it is required.
Yes.
So, ma'am, just I would like to know, and the same things like in mobility, like the stretching and stripping exercises would be required even after discharge also. So, like you mentioned that I have used the unnecessarily past perfect tense.
Yes. He has been
So,
advised present perfect tense. He has been advised to continue stretching and strengthening exercises.
rather than past perfect, present continuous.
Past perfect means it happened at some point of the time in past, and it is not continue anymore because past perfect. Present perfect means it started in past and it is to be continued in present as well.
Okay.
So in my opinion, what are the common mistakes that I notice when I assess most of the students' writing is, as I discussed earlier, mistakes in understanding the case notes. And that happens because you are too much in hurry to start writing the letter. So be very, very careful about those EDs, organized, advised, counseled. So you know that these things have already been done. And the way in which you would write those sentences will be exactly opposite to the way in which you will be writing a request sentence. For example, if say for example, if the advice has already been given, then we would say she has been advised to do something. And if it is something you want the reader to do, then you will be saying, please advise her to do this. Now, there is a huge difference in this meaning, isn't it? One is you are just informing them that we have given this advice, and the other one is you are telling them to give that advice. So be very, very careful about those EDs. The second most common mistake is in the task reduction, where you end up writing a lot of irrelevant information, particularly when the diagnosis is confirmed. So if you are writing at the time of discharge, and if the diagnosis was confirmed, most of the time you are discharging the patient because patient has now recovered from it, or at least they have been treated for it. They have stabilized a little bit. So in those cases, you don't need to write the details of their initial signs and symptoms and initial physical examination, test results, because all of that is required to make diagnosis. Now, when you are writing the discharge plan, the other person doesn't need to make diagnosis. So in that case, you can directly write what was the diagnosis and focus more on then how it was treated, what is the patient's current condition, and how, what needs to be done for it after the discharge. Those are the key areas to focus on. So being aware of whom you are writing to, being aware why are you writing that letter, and based on those two things, you have to do the task reduction. And when it comes to organizing information, paragraphing, we have learned three different ways of paragraphing. So that also is something you should first decide whether this letter, can I write in chronological order? Do I need to explain how the symptoms have progressed? Use chronology. Do I have a lot of information about during hospitalization? Use chronology. Do I have a lot of, um, you know, topics to cover like exercise, diet, medication? If I have more topics, then go for subject-based approach. So it is easier for the reader to understand that they need to take care of three things or four things after the discharge. And after that, start writing the letter. Don't jump to writing as soon as you receive the question paper.
Ma'am,
Dr.
and this
Paras,
last,
just a moment. Dr. Paras, if you have any questions, feel free to unmute yourself and ask, because we are
Yeah,
left with
ma'am,
just. Hmm.
I just joined it.
Hmm.
There was 2-3 questions, but I'll ask it. Let others finish first.
We have been discussing it
Mm,
for last 30 minutes, and we have only 10 minutes
yeah.
left now, so you can start with your doubt.
Okay. Mainly, first thing is the writing consists. We have to write with pencil, the whole
Yes.
letter. There is
It
no
is
need.
not necessary. OET doesn't compel you to write with pencil. They allow you to use both pen or pencil. But I recommend
Okay.
using pencil is because if you want to change anything, it will be easier. You can just erase it
Okay.
and write
They will
it
be
again.
providing, or we have to take it.
You
Okay,
have
ma'am.
to carry
They will
your
be
own
providing.
stationery.
Okay, and there are ones with the pencil type like 0.5, 0.7 mm lead, or the normal ones.
They don't allow mechanical pencils, so you should use the normal
Okay.
one.
Okay.
Mechanical pens or pencils are not allowed.
Okay. And madam, this recording will be available.
Yeah.
This letter.
Yes.
That means that this lectures.
Yes. Yes. That is
Okay.
why I recorded. So if anyone hasn't joined, they can go back to them.
Okay, ma'am. And there was another question in listening. Like there are options in part B and part C. Can we underline each and every question? Like they are giving 1.5 minutes for reading in paragraph.
Yeah, it's
So we
you
can
should.
underline,
You
highlight the
should.
important words.
Yes,
Okay.
you should. In fact,
Because
you just
ultimately,
have to make sure that you just have to make sure that the options A, B, C, D, wherever it is written, that particular circle should be clearly marked. Otherwise, the computer might get confused whether you have circled the first option or the second option. So keep that area clean. Whatever writing you need to do, do it in the words, like you can highlight perfectly fine. And if you need to write anything, write on the other side of the paper.
okay. Okay.
Yes, Jackie, you were asking something?
yes, ma'am. And ma'am, if we want to change the answer, even we have circled it out, so can we change it?
Yes. Basically,
Erase
you
it
don't
and
have
can
to
we select the?
circle. Basically, you don't have to circle. You have to fill in that circle. just like you do it in OMR sheet. And yes, you can change.
can change
That
it.
is why, yeah, that is why we use pencil so that these things become easier for us. And in fact, in part B and part C, pencil is
Ma'am,
compulsory for reading and listening.
okay, ma'am.
Ma'am, do we have
And
to
then
bring your own headphones?
No, it will be provided by the center. You're not
Okay.
allowed to have any electronic gadgets on the exam day. So no mobile phone, no wristwatch, no earphones, nothing.
Okay.
And ma'am, in writing, in the last, like after we recommended or after we request some of the care that has to be followed, right? Yours sincerely. So it is always we have to mention yours sincerely only.
We use faithfully if the reader's name is not given. Generally, we use the word faithfully when we are writing to an unknown person. Like if it only says
Unknown person.
emergency, yeah, if it says emergency consultant, but the name of that consultant is not given, in that case, we'll be using yours faithfully.
And at last, our name is required, ma'am, or only like charge nurse or community nurse.
Yeah, just the designation, your name is not required.
And we need to just leave one or small space between your sincerely and the designation.
Yes, but not an entire line.
Okay. Line is not required. You don't
No,
have to skip one line.
no.
Only it is required between regarding when we are starting the letter and the date and the name to whom we are writing.
And
In these
even
three,
at
we
the
have to.
end, after closing line, you will be leaving one line and then yours sincerely. Your
But
closing
between
line.
this, okay, after recommendation or after request, one
After
line.
that, you have a closing line, no? If you need further information, that is your closing line. So after closing line, one blank line, and then yours sincerely or faithfully.
Okay.
And then your name, then your designation. Then there is no need to leave line in between those spaces.
Okay. Initially, it is required between like date after date, one line we have to.
Basically,
One is
see if
after address.
I clear your concept, it will be easier for you to decide. Whenever you are starting any new topic, for example, you wrote address first. Now, after address, you are writing date of writing. So, there are two different things. You leave a line. Similarly, closing line is a part of your paragraph, isn't it? And after that, you are starting sign off. So, you leave a blank line. Wherever you change the topic, you leave a blank line. So, it is separated for the reader. Basically, leaving line is to separate the things out, isn't it? Okay. Is there any further question? We still have about 2-3 minutes left.
Ma'am, there was one question in which we were writing a letter to an endocrinologist, and there were past visits unrelated to diabetes, like upper respiratory tract infection, and one or two parameters like vitals, BP was mentioned. So, do we need to consider an infectious mononucleosis was there? So, how infectious mononucleosis is related to diabetes? So, can we just eliminate, or we have to mention that sometimes there are unrelated? Yeah.
It is just that infectious mononucleosis is something that remains dormant and it can
Okay.
become activated when someone's immunity is low.
Okay.
And as we know, diabetes puts someone in the risk of getting more infections. So that is how
Okay.
it is related.
So in that view, we have to mention that pastly he was suffering from upper respiratory tract multiple times. Just
Yeah.
mention it. We don't have to focus when and
As a
why.
past medical history. That's it.
And sometimes the letter is lengthy, like more than 200 words. Are we penalized on that?
So what examiners will be looking at it, they will find out the reason why is it lengthy. And if it
Okay.
is lengthy because you have included a lot of irrelevant information, you will be penalized under conciseness and clarity criteria. Because conciseness and clarity checks whether you have included any irrelevant information. Two, they
And
will
the
think
word count?
yeah, so that is what I'm saying. The second thing they would look at is your letter long because you haven't summarized it well? Then also
Okay.
you will be penalized under conciseness and clarity criteria. But if none of that is a problem, you have
Mm-hmm.
excluded all irrelevant information, you have done a good summary, and still your
Mm-hmm.
letter is slightly longer, let's say 210 words, then
Okay.
there will be no penalty for it.
Okay.
The examiner will be not counting exactly word to word, but this is how they will look at it, why the word count is longer.
And in some cases, occupation and the person is having 3 children and the writing to an entrepreneur. Do we just eliminate it or we have to write it? Like it is there in the history that it's father of 3 children. He's working as a receptionist or an accountant.
Only if you think it has any connection with the purpose of writing.
So I had written one, but there was no connection between diabetes and this. So I was wondering whether to write it or whether to avoid it.
Yeah, so if, as I said, if it is not relevant
In
to
that,
their current condition, you can skip that. Occupational
okay,
details are
okay,
still fine because we use it to introduce to someone in referral letter. But married,
okay,
children, those details only if they are directly related to the current condition.
okay. Thank you.
So is this the right time for us to end this session, everyone? Do you guys have any
Ma'am,
further
So
I have
questions?
just
one question.
Yes.
If they are not allowing to use wristwatch, so how can we assume what's the time?
There will be a huge screen in the exam hall where you can see the time.
Okay. With
Yeah, because
seconds also?
yes, and I'd recommend that in any of the tests, whether it is reading or writing, don't keep watching, don't keep counting your time constantly. You don't need to check every second. Yes, otherwise you will not be able to focus on what you are reading or what you are writing. So it is good to keep a track of time, but don't be over conscious of time. Just know that you have to do it as fast as possible because in reading also, it has to be, skimming, scanning. Really, you have to be fast. So instead of looking at the clock again and again, invest that time and energy in reading as fast as you can. Don't be a clock watcher in exam. And they mainly don't allow any of these kind of accessories or gadgets is because it has a huge chance of cheating and these devices can be misused. So that is why it is not allowed in the exam hall.
And ma'am, in writing, they will give us proper blank page, or in the page they has lining also.
Yeah, it will be a lined paper only.
Okay.
And even when you will start taking mock test here, we will be giving you that actual answer sheet. So you will get that practice of writing in the actual answer sheet during the mock test. Otherwise, if you want to practice it even for your assignments, you can download it from OET's website. If you go to occupationalenglishtest.org and if you go to the writing subtext, you will see a sample answer sheet has been given there. So if you just want to, get used to that, you can download and print it.
Okay, ma'am.
Even those of you who plan to take online mock tests, so when you are taking the mock test, try to print that answer sheet from OET's website and use it.